Hey guys, so today I'm back for another pregnancy update. I am currently 40 weeks and 1 day pregnant, so I'm officially overdue now. My apps say the baby is measuring approximately around 20 inches long and most likely between 7 and 8 pounds. So for a size reference, that is the size of a pumpkin or a watermelon. So baby has gotten quite big. As far as my symptoms over the past week, I have been having I don't know if I told you all in the last update or not, but I've been having some cramping in my lower abdomen. I believe I did tell you all that. But it has turned into like when I have to go pee, when I feel the urge to pee, and then even after peeing for a couple minutes, that I have some pain in my lower abdomen, like right where my bladder is. So I didn't know if that was the baby coming down, getting heavier, and just being on my bladder, or if possibly I might have a urinary tract infection. So that's what I was debating between, and I will get more into that here in just a minute. And then also one exciting thing that happened was this past weekend I did lose my mucus plug. So that has been now about 4 or 5 days ago. I've still not had baby yet. Which I know mucus plug, you could be going into labor right then, or some people it takes them 2 weeks even after they've lost their mucus plug. But I've still not had any contractions. Nothing really new with my symptoms besides what I just mentioned. So this video is going to be a little bit different because I'm going to tell you all about my doctor's appointment that I had and all the trouble that I had at my doctor's office. I have become really disappointed with them and just the way that they really just treat their patients. And I will tell you all about that now. So last update, I told you all that I was going to have a doctor's appointment on my due date, which was March 9th, which was yesterday. So my husband took off work around 1:30 because my appointment was at 2:30 and I had to check in a little bit after 2. So I went in, checked in, and at my doctor's office, because of COVID protocols, they make you come in and just sign in, and then they have you go back to your car, and registration is supposed to call you to register you. So at this appointment, if you all have watched last video, I was supposed to get an ultrasound to check on the baby, and I was also supposed to get a non-stress test to watch the baby's heartbeat, make sure everything's fine there, and then also just have a regular routine cervical exam appointment. So we get there about 2:15, we check in, we go back out to the car, and it's been 45 minutes, so it's 3 o'clock now. So I'm like, I wonder if they forgot about me. So I go back in, and I asked the lady at the front desk about, I've been forgotten about, registration has never called me. So she goes and checks with registration, and they say, oh, we don't need any updated information from her. So they just tell me to go back to my car and wait for me to be called for my ultrasound. So I go back to my car. By this time, it has been almost 2 hours that we have waited, at least an hour and a half. And like I said, my husband has took off work for this appointment, so he's missing half a day's work to come with me, just because the only time they will allow him to go with me is if I'm having an ultrasound. So they finally call me and they say to go ahead and come in for my appointment. So my husband and I walk in, and the assistant who's bringing me back, you know, the one who just does your vitals and everything like that, She says, oh, you can't go back, talking to my husband, and says, you're not going to have the ultrasound today, or the non-stress test, or the NST. You're just going to have a routine exam. So me and my husband are pretty mad at this time. My husband's like, I just took off work half a day for this. We've waited in the car for 2 hours. So he goes back out to the car and goes on a little errand just to clear his head a little bit. And I go back to my appointment just to get that part done. And I talk with them a little bit about how I was supposed to be scheduled for all these tests today and everything that's going on. But anyway, so I'm supposed to be seeing my regular doctor. That's who my appointment was scheduled with. So I go into the patient waiting room, you know, just the exam room. And it's not my doctor that comes in. It is a different doctor. So I'm not even seeing my doctor today. And let me back up for just a moment. While my husband and I were waiting in the car to finally get called in, we actually saw my doctor there, but we saw her get into her car and drive away. So she was there, but she did not stay to see me. I'm not sure what happened there, but anyway, now I'm back in my exam room with this new doctor. I've seen her once before. But she goes ahead and she does a cervical exam on me. And she doesn't tell me how dilated I am, how phased I am, or anything with that. So I'm like, okay. So she listens to baby's heartbeat. Heartbeat was 160, so that was good there. Then I tell her that I've been having the abdominal pain in my low belly, and I thought maybe it might be an infection. And she said, yes, you have an infection. There's white blood cells in your urine. And I was like, okay, that explains it. So she asked as the assistant, do we still have her urine? And no, they don't, because they threw it away. So I have to go and pee in a cup again. And that's for them to send it off for a culture. So I do that, and the doctor, you know, has already left the room. I'm peeing in a cup, and they always give me a paper to check out when to come back at the end of my appointment. So she never had given me that paper, so I thought, you know, okay, I'm going to pee, go back to the room. They're going to talk to me a little bit more about my cervical changes and everything like that. So when I come out of the bathroom from peeing, the assistant hands me my yellow paper and says, come back tomorrow and we're going to do your ultrasound and your NST then. And I'm like, she didn't tell me what I was when she checked me. So the doctor is actually sitting at the desk, and the assistant asks her and stuff, and the doctor just says, oh, she's about the same as she was last time. And I'm like, okay, that sounds really reassuring, like you know what you're talking about. So I'm taking that with a grain of salt. I don't know if she knew what she was doing when she was checking me. She couldn't even give me numbers. Just seemed really distracted. Also, I'm going to look at my phone a lot in this video because I have a lot of notes wrote down because of everything that happened. So just a second. So I have an online health record, like a patient portal type of thing. I'm sure you all probably know what that is. And I had looked at my urinalysis from the last appointment I had, and it even showed white blood cells, a trace of those on that urine. So at that time I had an infection also, and I don't know if they just didn't bother to call me or if they didn't look at my result or what, but I mean, I've had an infection for a week now, and it could have been treated last week. So instead it's just gotten worse. So So now I'm on an antibiotic. But that's another thing that's happened. So after my appointment, I scheduled to come back for the next day. And I go out to the car. My husband's there to pick me up. And he asks me what happened. I tell him. And he's like, I'm going to go in there and talk to them. And I'll be right back. So he goes in. He explains to them, I had to take off work. I've lost money coming up here for absolutely nothing. We've waited for, over 2 hours now. And now you're telling her to come back, and I'm not going to be able to come back to do the ultrasound with my wife tomorrow. And so they actually agreed to do my ultrasound and my NST because we raised complaints over it. So he calls me and I come on inside. I'm looking at my notes. So I come back in, and I'll just talk about the good things we learned about the baby now. I come back in, I have my ultrasound done. They're doing a biophysical profile, which checks the baby's fetal heart rate, fetal breathing, fetal movement, fetal tone, and the amniotic fluid levels. So at my doctor's office, an 8 is the highest number you can have, and the baby scored an 8. So she's perfectly fine in there right now. They did say my fluid level was starting to decrease, which is normal the farther you go along, so they're just going to keep updated on that. Baby was actually weighing approximately 8 pounds and 2 ounces. So she's measuring, in my opinion, a little large right now. But they said that measurement could be off by a pound either way. So I'm hoping she's more towards the 7-pound mark, since I'm continuing to be overdue and not went into labor yet. Then I had the non-stress test. They just put the belly bands on me and monitored me. Actually ended up being probably for about 45 minutes. And they just watch her heart rate to make sure it's having accelerations and decelerations, and everything was perfectly fine there. So then one of the other assistants comes in, unhooks me, and I'm like, I don't have an appointment to come back because I was supposed to do all this. They had rescheduled me for tomorrow to do all this. So I need a new appointment date. So she has to call the doctor and ask her when she wants me to be seen again. So they tell me to come in Friday, which would have been, this all happened on Tuesday. So Friday would be 3 days from then. So the assistant walks me up to the front desk, and she's apologizing for everything that's happened. And I go up to the front desk, and there's nobody there to check me out. And there's also another patient in front of me that's waiting to be checked out, and no one's there. So the assistant actually has to page someone to come and schedule me and the other girl that's waiting there for our appointments. So someone finally comes to schedule us an appointment date, and when they get to me, they tell them that she needs scheduled with her regular doctor on Friday. So the girl scheduling is acting like she's having a little bit of difficulty finding a place for me with my doctor on Friday. So they eventually end up scheduling me. So we leave there unhappy, but finally everything's over. Pregnancy's almost over. We'll just be thankful to be done with this office. I'm not sure if we're going to go back here for any future pregnancies or not. But they actually called me right before I was getting ready to do this video and said that my doctor would not be able to see me on Friday, and that they needed to move my appointment to Thursday. So I now have an appointment for tomorrow, and I'm going to have another ultrasound, another NST, and another just routine visit. Hopefully everything goes smoothly tomorrow and there's no issues. It's just been stressful and unnecessary. I believe I've told you all everything that I wanted to mention. But I will have my appointment tomorrow if baby doesn't come, and I will update you all probably tomorrow. But I'm hoping she comes sometime between, today is the 10th. I'm hoping, we have a couple things we're doing the next couple days. So I'm hoping she comes between Saturday the 14th and between Tuesday the 16th, I believe. Because that will put me at 41 weeks, and I think at that time I'll probably be looking at induction. So I'm just really hoping she comes this weekend would be the best thing. But I will go ahead and show you all my 40 week, 1 day belly. So let me scoot back a little bit here. So here is belly. This is with the shirt up. And that's all I have for this video. I hope you all enjoyed, and I will talk to you all next time. Thank you.